On October 17th, 2007, I was your average high-tech marketing director, working in the Silicon Valley, working crazy hours, loving my job, really enjoying what I did, but really pushing myself very hard. A small hitch in my throat every time I would swallow, causing food to get stuck, got my wife very nervous. And so my wife forced me to go to the doctor. And so I got a call 24 hours after that, and I got a call on my BlackBerry, and they said, "Can you talk?" And as I was walking towards my, private phone carol, they said, "You have cancer." We soon found it was gastric cancer or stomach cancer. After going through several consultations, we decided to get treatment at Stanford's Comprehensive Cancer Center. And probably, other than marrying my wife, was probably the best decision I ever made in my life.
So JP was a new patient of mine. Soon after he got diagnosed, actually, with stomach cancer, he got referred to me by his surgeon. So I walked into an examining room, and JP and his 8-month pregnant wife were waiting there and pretty nervous, as you can imagine.
When I was first diagnosed, I did what I think anyone in a similar situation would do, is I tried to find as much information as I can. The way I do that is the net. So I went out and I did searches, and the information I got back was dated, was inconsistent, and was extremely negative. I started to think about, how could I solve that problem? I'd had some experience in the nonprofit sector, and I thought, there really needs to be an organization out there dedicated to really supporting and educating gastric cancer patients and helping fight the disease from a research perspective. So at one of my scan results, in one of my clinic meetings, I actually brought it up to my oncologist, Jim Ford.
He said, I just feel like there's not much information out there for patients like me who are going through this kind of treatment. So he said, what do you think about starting a foundation to try to help new patients deal and cope with everything that they're going to go through in this treatment? Well, that was just the germ of an idea. I thought it was a fantastic idea because I have lots of other patients and they have the same frustration of not knowing where to get information. But it really spiraled from there to thinking about, could we actually help support research that could even impact gastric cancer? And he just took it from there. At one of our early meetings around the Gastric Cancer Fund itself, as JP was getting better and I wasn't seeing him as a patient so often, which was terrific, we really sat down and brainstormed about, and he just asked me if, in the best of worlds, if you could fund any kind of research you think could really help this, what would you start with? What's missing out there as a foundation? And so I told him what I thought would be the ideal thing, and that was starting a registry around gastric cancer to gather information about stomach cancers, to gather data and even the tumors themselves in a central place where it could be used as a resource for stomach cancer.
We need to actually build a database or a registry so that doctors and researchers from around the country and ultimately around the world could use that to, identify hypotheses and go test against it.
More common cancers, breast cancer, colon cancer, lung cancer, and some others, there have been efforts around this, and they've been really quite successful in helping us learn more about the causes of cancer, about how it can vary in different ethnic groups and in different parts of the world, and even in helping with treatment. But stomach cancer hasn't had that kind of organized effort around it yet. There's a new field called genomics, which is an approach to look at all of the genes in the body at once, is going to be a very powerful approach to try to find new biomarkers or targets for treatment or prevention of stomach cancers. So we believe that by looking at the entire genome of a gastric cancer, and ultimately many gastric cancers, we'll be able to identify targets that we can use for things like early detection, maybe a blood test, for prevention, maybe a target that we could treat that'll prevent cancer from happening, and for risk assessment, trying to figure out which people might be at particular risk for stomach cancer and need those kinds of interventions. And so our initial, very basic concept is to start a registry, gather this information, gather the tumors, and learn with information about how those patients did, and actually start probing the DNA to see if we can figure out why those cancers formed, and if we can identify new targets to treat them better. So that seems like a simple idea, but it's a fundamental part of research that really has not been done in an organized way for stomach cancer before.
The website's got a dual purpose. Website, first and foremost, is really an education and support place for gastric cancer patients like myself. I wanted to have a centralized place that really demystified the disease, didn't make it appear that, again, gastric cancer is a death sentence, because it's not. But was very honest about, hey, here are the stages, here are the symptoms, here's the treatment plans. There's so much comfort in knowing that there are other people going through a similar experience. And so what the website will really do is hopefully educate people, but really give them the support that, hey, there are people out there that are doing this. And not only are they surviving, they're thriving, right? And it doesn't matter if they have a stomach or they don't have a stomach, or they're stage 1 or they're stage 4. They have an opportunity to live, they have an opportunity to thrive, and we want to support that, and we want to perpetuate that message. As we had the initial conversation about what we wanted to do as an organization, and really the registry or the database came up, the first thing that popped into my mind is, well, who's the best company in the world to house and to store databases? And that's NetApp. It's a no-brainer. So I immediately thought, well, gosh, this is something that we could get NetApp involved in. And then as the organization started to think, okay, well, we'll build this registry, we'll do kind of database analysis, and then we'll start doing sequencing, I started to think about, wow, high-performance computing, capability of high-throughput systems. Again, who does that best in the world? NetApp. So it was really a no-brainer to say, man, this is kind of a little bit of serendipity that here's this guy that has gastric cancer, gets hooked up with this hospital that really wants to do this cutting-edge stuff, and he happens to work at really one of the best companies in the world to be able to provide the infrastructure. And it was just, to me, it was this kind of perfect confluence of things happening, and then it was just a matter of going and approaching NetApp and seeing if they'd be willing to do it. So I just went ahead and made my pitch and said, this is what we want to go do, and I was just amazed that it was never a question of if, it was just a question of when.
It's state-of-the-art equipment. It will enable us to house all 3 research projects. Without NetApp, this project would be delayed 3 or 4 years.
When I think about the long-term vision of the Gastric Cancer Fund and where we will be 5, 10, 15 years from now, it's hard to kind of deal in those specifics. But I have a goal, and it really is, someday we're going to shut this thing down, right? Because we're going to solve gastric cancer. And someday we won't need the Gastric Cancer Fund anymore.